Good evening, one and all. We welcome you all. Good evening, one and all. We welcome you all to the third day of 1 week international seminar on women, child development, maternal health, breastfeeding, awareness, education, environment, health, well-being, and sustainable development 2023, commemorating Azadi Ka Amrit Mahotsav, nation celebrating 75 years of independence, United Nations Sustainable Development Goals 2015 to 2030. As part of awareness and campaigns, India's G20 presidency, and also commemorating World Breastfeeding Week 2023 with the theme, Let's Make Breastfeeding and Work, and also various other commemorations in collaboration with Sri Holistic Health Foundation India, Sri Research Institute and Center for Art, Sciences and Wellbeing, and others. So before we start our sessions, let's take the blessings of Almighty.
शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः.
With the blessings of Almighty, we shall continue with today's sessions. Today, on the first day, we have looked at various aspects of breastfeeding and how it is important and relevant and fostering both mother and child health and well-being, catering to the diet and nutrition of both mother and child. And we also have seen how breastfeeding is contributing to the achievement of sustainable development goals in all aspects. And not only that, we have seen how breastfeeding is not only contributing to health, but also wealth of the family, economic status of the families, as there is no additional burden on the family, and it also eliminates poverty and eradicates poverty and various aspects of dimensions of development. So today we will look at various other aspects of breastfeeding and how it is contributing to planet at large. So when we are looking at breastfeeding, there are various aspects like how early the breastfeeding should be initiated, as we have seen earlier 2 days also. Management of breastfeeding should be taken up properly. In breastfeeding should be initiated within 1 hour of birth in all healthy infants. Even as early as possible. So that frequency of breastfeeding should be as often as the baby wants. So demands feeding for both day and night. So baby needs frequent breastfeeding, and it varies from baby to baby, though there are general average feeding requirements. And a careful history and physical examination of the mother and baby should be performed, as well as observation of the breastfeeding session when there are concerns about inadequate breast milk or any other breast or breastfeeding related issues. So counseling, if required, with other clinical investigations, if required, needs to be advised by a professional medical officer who is taking care of the client. And there should be an universal availability of skilled counselors. They may be psychologists, they may be counselors, they may be social workers or medical professionals for the initiation of breastfeeding at birth and support during the stay at hospital at the time of discharge. And exclusive breastfeeding should be practiced through the first 6 months of life and should be continued till 2 years or 2.5 years. So routine use of multi-component fortification of breast milk should be avoided. Their use should be restricted to infants 32 weeks gestation or less than 1500 grams birth weight who fail to gain weight despite adequate breast milk feeding. Generally 2.5 kg is considered the normal weight. So anything below that, somewhere around, again it varies, 1.5 to 2.5 kg, but anything less than 1.5 kg, the baby is underweight. So if the mother is not able to provide adequate breast milk to feed the baby due to various reasons, then alternative fortification should be taken up. Otherwise, alternative arrangements have to be made for breastfeeding the baby adequately. And coming in, there might be various queries by the mothers, like when we should start breastfeeding, how it should be done, how frequently it should be done, how long it should be done, and what should be the duration of each session of breastfeeding, and how to assess adequacy of breastfeeding and how to breastfeed in a maternal illness and how to express breast milk and how to know whether the expressed milk is adequate or not, and how and when to fortify breast milk if at all required, and how to supplement if the breast milk is not adequate, if required, if only required for very low birth weight children, and how should sufficient or insufficient milk supply should be maintained or managed, and maybe different myths or contradictions or taboos that are prevailing related to breastfeeding, and many more, because different mothers from various backgrounds may have different queries or clarifications. So accordingly, whatever information they require should be adequately addressed in a very scientific way. And especially hospitals play a great role in promoting and creating the impact of breastfeeding initiation. So educating nurses, physicians, and other healthcare professionals working in the hospital regarding the dynamics of breastfeeding have a significant influence on initiation of breastfeeding. There are various national and international guidelines recommending initiation of breastfeeding as early as possible or within 1 hour of birth, and as well as providing colostrum to the baby, because that is very important for the baby. The baby should receive the first breastfeed as soon as possible and preferably within 1 hour of birth if there is any delay. And early skin to skin contact is also important after delivery, and the opportunity to suckle within the first hour after birth are also important. That's why we have seen the importance of kangaroo care, kangaroo mother care, and it is highly recommended across the world. Skin to skin contact with the child and the mother or any caregiver, preferably even father also for that matter, improves the health and well-being of the child as well as the mother and caregiver. So healthy infants after the delivery should have immediate contact, skin to skin contact with their mothers, and mothers and babies should remain together and room in the same hospital room throughout their hospital stay to initiate early breastfeeding. All the mothers who are breastfeeding should have no restrictions regarding breastfeeding. As per their requirements, they can breastfeed whenever, wherever, whatever time they require to breastfeed, as long as the baby demands. So they should be advised to breastfeed their babies whenever they are hungry or often whenever the baby demands or often as the baby wants to feed, even demand feeding. So they should take their babies' verbal and non-verbal communications as cues for breastfeeding, and they should wake up their babies for breastfeeding if the babies sleep too long. Generally, babies sleep for longer time. But at the same time, we need to feed them constantly so that they can stay healthy. So we should wake the babies for the breastfeeding. The babies sleep too long or the mother's breasts are overfull. So scheduling feeding leads to breastfeeding problems and insufficient milk production, which can cause mothers to start artificial feeding. Breasts also need stimulation so that they can produce more milk. In that way, the baby sucking and the baby breastfeeding procedure stimulates the breast to continue to produce more breast milk. So they should be advised to breastfeed as frequently as possible and as longer as possible to extended periods, that is even after 6 months. And often baby rests a while during breastfeeding. Often we see, mothers are worried. Suddenly babies fall into sleep while they are being breastfed. That is quite common. No need to worry about that. And it is an active process because we also, after consuming food, especially lunchtime, we all are evident. Once we have a stomach full of food, what we feel like sleeping, right? So similarly, the babies also go to sleep. So no need to worry. And at times they may get detached to the mother, or at times they can continue to remain attached with the breast. So there is no need to wake up the infant or remove the breast, as he or she, the baby, starts suckling on its own till baby leaves the breast. So restricting length of the breastfeeding session may have adverse effects like result in baby getting less of energy rich milk. So unrestricted breastfeeding is only possible and should be promoted. And this is also only possible when both mother and child is together. If they are separated, again, it depends on the mother and caregiver and the nursing staff and all, because they have to keep observing and they have to keep bringing together, and the skin to skin contact will also be less or not adequate. So it's always better. Now the practices are widely prevailing. Mother and child should be kept together 24 hours, 24/7, which enables mother to respond when their infant shows readiness to feed and to establish a bond between the mother and child. So when the baby should be fed as frequently as possible, as the baby demands, during day as well as night. So this can be stressful for the first time mothers, especially because night and day they have to breastfeed, so they can be deprived of sleep or stress. But the joy or the happiness of the satisfaction of feeding her child is more, comparatively large amount, more than the stress. But it is also a positive stress. In fact, a lot of joy and happiness, a satisfaction, a confidence within the mother. So that's why mothers and child should be supported by the family members and the caregivers. And exclusively breastfeeding is important and sufficient to support optimal growth development for this first 6 months of baby's life, and provides continuing protection against various diseases, viruses, infections, and promotes immunity. From 6 months, after 6 months, mother can give supplementary feeds along with the breastfeeding. Breastfeeding should continue till 2 to 2.5 years, along with breast milk. Supplementary feed can be given as per the requirements. Even when a mother perceives that her milk to be sufficient or insufficient, the baby may get all the milk she needs. So the fact that the breast milk production is determined the amount the baby draws from the breast. So that's why this breastfeeding also promotes milk production. Mothers who think that they do not have enough breast milk, or those who think they need the help and support of a person skilled in breast milk management, they can approach. So how do we know whether the baby is adequately fed, whether the milk is sufficient? We cannot express the milk and measure it and again give to baby, right? Again, there is a lot of contamination and other things happen. So what we can do, generally what is being practiced before breastfed and after breastfed, babies are weighed. Generally, this is not a general practice, but in clinical observations, before breastfeeding the baby is weighed, and after breastfeeding the baby, again, the baby is weighed. So the difference before, after, pre, post breastfeeding will help us to keep track of the health and nutrition of the baby. And also baby's weight, how much baby is gaining weight or losing weight. If the baby does not gain weight by 2 weeks of age, or the cumulative weight gained is less than 500 grams in a month, or the infant is passing small amount of concentrated urine less than 6 times a day while on exclusive breastfeeding, then there is a caution or there is a concern about the adequacy of breast milk. So insufficient weight gain in breastfeeding baby may occur due to various reasons. So what might be the reasons? The infant is not feeding effectively. The infant has a higher than expected calorie need, or mother has insufficient milk supply, or though there is adequate supply, baby is not taking the milk, or various other reasons. So these are the most common reasons which are seen. So how do we approach to these problems or issues? So health workers, medical professionals need to help the mothers in such a situation. First, decide whether the baby is getting enough milk or not. So by various procedures, some of them are mentioned. And if baby is not getting enough breast milk, then decide why it is happening. and decide how to help the mother and as well as the baby. So mothers may require additional support and counseling. And how do we recognize whether what are the signs of sufficient milk intake? For mother, breasts are full before feeding and softer after a feeding. If mother can observe that before feeding, her breasts are full, and after feeding, her breasts are softer, so that is a sign of sufficient milk intake. And she might also notice let down reflex during the feeding. So she can notice that milk is coming from her breast to the baby. Milk is flowing from her body, from the breast to the baby. That is let down reflex. So mother can feel that, mother can sense that. And for infant, what are the signs or how do we know that there is sufficient milk intake? Audible swallowing heard during feeding. You can hear when the baby is suckling or suckling the breast milk, you can see the baby suckling the breast. And also while baby is swallowing, you can hear the sound. Like we also, when we swallow, we also make sounds, right? So we can hear the sound. And baby after feeding or during feeding, before feeding, the baby may look hungry or restless because baby is hungry and wants to get fed. So after or during breastfeeding or after breastfeeding, baby appears to be relaxed and satiated because her requirement is met, baby's requirement is met. So baby feels relaxed and satiated. It is full, satisfied. And baby is awake, alert, calm, times between feedings. That is also a sign of sufficient milk intake. And if baby is breastfed 8 to 12 times in a 24-hour period, then it is also a good sign of sufficient milk intake. So generally, baby is fed 8 to 12 times, almost once in every 1.5 hours to 3 hours. Generally, 2 hours or 1.5 hours, depending on the baby. So at least 8 to 12 times, if mother is nursing or breastfeeding the baby in a 24-hour period, then it is a good sign of sufficient milk intake. And also, the weight, as already mentioned, if the baby gains 20 to 30 grams a day after 3 to 5 days of life, then it is a sign of sufficient milk intake. So the baby is growing and having adequate nutrition, diet and nutrition. So how we will be able to find it? By careful history and physical examination of the mother and baby should be performed, as well as the observation of breastfeeding session when there are concerns about breastfeeding or inadequate breast milk. So the adequacy of milk intake can be assessed by counting the number of wet diapers per day, the number and quantity of stools, and also the weight gain. So these three parameters are also considered assessed. For the adequacy of milk intake. Now, what we can look at various strategies to help mothers to breastfeed and maintain breast milk supply during separation of mother-infant. As breastfeeding is not totally instinctive behavior, the technique often needs to be learned because it is not an continuous process. Only when mothers become pregnant or when they deliver baby, this process, this behavior continues as long as the baby requires. And once the baby is completely fed on other supplements or on a normal diet, after 2.5 years or after 2 years or after whatever the period is, generally this behavior stops, and also breast milk production also stops automatically. The reason the hormone productions and even the regular cycle starts resuming. So, and it prepares the mother for the next pregnancy. So it has been reported that establishing of breastfeeding and relactation can be achieved in more than 90% who are unsuccessful in breastfeeding within 6 weeks postpartum with support. In the event of separation of mother and infant due to various like PTSD or postpartum after delivery for mothers, mothers should be taught expression of breast milk, and the expressed breast milk must be fed with a cup or spoon in comparison to bottle to prevent nipple confusion and later problems of attachment of baby to the breast. So adequate training and frequency of milk expression are necessary to achieve adequate lactation and eventually to establish breastfeeding. Because the baby needs to be fed every 1.5 hours to 2 hours or 3 hours. The cycle has to be maintained even if baby is not directly breastfed from mother, but the expression of the breast milk should continue periodically so that they get stimulated and they continue to produce breast milk, and also to improve the production of breast milk. So adequate techniques and frequency of milk expression are necessary to achieve adequate lactation and also eventually to establish breastfeeding. And as already mentioned, expression of milk should start as early as possible after birth, and frequent expression at least 4 times a day minimum when there is a separation between mother and child leads to more production of milk. Some experts recommend 8 to 12 times in the first week. As the baby grows, the requirement increases. And initially, there will be less production of breast milk, but gradually, the breast milk production also increases. So initially, there may be up to starting from 150 ml of breast milk production. It can go up to, on an average, it is somewhere around 850 to 1200 ml. Again, in some exceptional cases, it can go up to 1400 to 1600 ml also. and even more also. Again, it all depends on the mother. And as already mentioned, it is not the size of the breast that impacts the breast milk or the quantity of breast milk, but the milk carrying capacity of the breast. Don't assume that the bigger the breast, the more the milk. It's not so. Or the smaller the size, the smaller will be the quantity of milk. It's not like that. Generally, it is the milk bearing capacity of the breast, the glands in the breast, that determines the quantity of milk. And also the various factors that has been already mentioned regarding like stimulation of the breast, frequency, and persistent stimulation through breastfeeding that helps creation of increase in the production of milk. So there are certain breast practices to maintain lactation in mothers separated from their babies. Actively encourage and support breastfeeding. Start milk expression in the first hour or first 24 hours of birth. Aim for the first oral feedings to be at the breast. Encourage milk expression 8 to 12 times per day as per the requirements. Communicate the progress of the baby and involve mother in day-to-day NICU baby care. Respond to maternal concerns, stress, anxiety, or insomnia related to infant's changing condition. Discuss identified maternal risk factors for lactation. Avoid hormonal birth control during early postnatal period. Make provisions of hospital grade or clinical grade breast pump and collection kit and storage containers if the baby is not directly breastfed. These are only when mother and baby is separated because of mother had certain issues where she cannot take care of baby, mostly due to psychological reasons or various other factors, and provide educational material and information addressing common breastfeeding concerns, and recommend specific medications to the mother that are compatible with the lactation. Educate staff also and caregivers to support breastfeeding. And apart from these interventions, non-pharmacologic interventions in the NICU, that neonatal intensive care unit, that optimizes maternal milk volume, the increase in breast milk production during the infant's hospitalization. So provide 24-hour visitation and access to infant for the mother. Consistent message about the importance of human milk from all NICU clinicians, and use of expression of breast milk at infant's bedside. So the facility should be also available at the infant's bedside. There itself, mother can express milk either through breast pump or directly through breastfeeding, and daily skin to skin contact or holding in NICU. Comfortable and supportive infrastructure like chairs, tables, or beds or bedside accessories, appliances should be available for the mothers so that they can feed and stay and support the baby within the NICU. Daily tasting of milk, suckling at emptied breast regardless of infant weight and gestation. This is very important. So whether if baby has any issue in suckling the breast milk, even if baby is not sucking the breast milk also, baby should be introduced. I mean, the breast should be introduced to baby. So daily tasting of milk, that is suckling of the even emptied breast. So once the milk is expressed, the breast becomes empty. As the milk is fed in different way to the baby, but constantly, gradually, the baby should start the practice of breastfeeding. So babies should be taken closer to the breast, and breastfeeding or the suckling by attaching the baby to the nipple is important regardless of infant weight and gestation. Anyway, the breast is empty. So even if baby, it is not always completely empty. Actually, this promotes, because there might be some issues with the baby, unable to swallow or unable to suckle. So these, in spite of that also, babies, because when there is a flow, when we are drinking something, when there is some difficulty, we might face problem. Otherwise, just simply, the baby can practice suckling. And peer support for expressing milk and other NICU specific activities has to be promoted, because especially first time mothers may face difficulty, and so they may require support for expressing the milk, how to express, when to express, and the procedure to express and procedure to collect the expressed milk needs to be supported. And also, milk volume record should be maintained to identify expressing patterns and should be reviewed, because we should also know whether the baby is getting adequately required amount of breast milk or not, feed or not, because baby is not fed actively through breastfeeding as and when baby demands, because baby is in NICU and separated from mother. So every time the mother expresses milk, that should be recorded. The quantity of the milk should be recorded so that we know whether the baby is getting adequate amount of milk or not. And also, observations of mother using manual expression, or whether she is using any pump, whether it may be manual or electrical pump in the NICU to detect any problems, or sometimes mother can express through her hand by pressing breast through her hands, or she may use any manual pumps, vacuum operated, suction operated pumps, or electric pumps in the NICU and detect problems, if any, in expressing milk. And it also should be ensured, especially no free formula samples or other promotion of artificial feeding, as we have seen how this industry, infant milk, formula milk industry, is leaving no stone turned to promote their products. So we should strictly ban, should not entertain any formula samples or any artificial feeding, and ensure the entire system, whatever system is being implemented, it is in favor, it supports breastfeeding. So we have to ensure that there is always support available for the mother and child, especially trained counselors, trained and skilled counselors, psychologists, social workers, or medical officers or paramedical staff for initiation of breastfeeding at birth, supporting during stay in the hospital, and also at the time of discharge. And especially in a situation where maternal separation from the infant, mother should be counseled and taught the technique of milk expression. She should also be taught how to feed breast milk with cup or spoon to baby. We should also encourage and support clinicians and educate them about the benefits of human milk, training and provision of breast pumps, and proper peer support to be effective methods of increasing breastfeeding rate. It's not that they don't know, but still continuously the latest update should be also provided and they need to be supported. Exclusive breastfeeding is defined by World Health Organization as the infant receives only breast food without any addition of food or drinks or not even water. That is the safest diet for the baby. Infant should be exclusively breastfed during the first 6 months of the life. The use of prolactin should be strongly condemned and discouraged. Almost all mothers can breastfeed successfully, efficiently, without any support, which includes initiating breastfeeding within the first hour of life and breastfeeding exclusively for the first 6 months. At times, a small number of health conditions of the infant or the mother may justify recommending if she does not breastfeed temporarily or permanently. So wherever stopping breastfeeding is considered or required, the benefits of breastfeeding should be weighed against the risks posed by the presence of the specific conditions like infants with classic galactosemia, that is a special lactose-free formula is needed. Infants with maple syrup urine disease, a special formula free of lysine, isoleucine, and valine is needed. Infants with phenylketonuria, a special phenylalanine free formula is required. Some breastfeeding is possible under careful monitoring. So infants who should not receive are with these conditions. These infants should not receive breast milk or any other milk except specialized formula milk. So infants for whom the breast milk remains the best feeding option, but who may need other food in addition to the breast milk for a limited period. Infants born less than 1500 grams, that is 1.5 kg, less than 1.5 kg or 1500 grams is considered as very low birth weight, VLBW. So infants born at less than 32 weeks of gestation, that are preterm babies or very preterm babies, newborn infants who are risk of hypoglycemia by virtue of impaired metabolic adaptation or increased glucose demand, such as those who are preterm, small for gestational age, or who have experienced significant intrapartum hypoxic ischemic stress, and those who are ill and those whose mothers are diabetic, and if their blood sugar fails to respond to the optimal breastfeeding or breast milk feeding. And various other conditions include certain temporary avoidance of breastfeeding of certain maternal conditions like severe illness, that prevents a mother from caring for her infant, for example, sepsis, postpartum psychosis, and helps simple virus type 1, chicken pox, direct contact between lesions of mother breast and the infant's mouth should be avoided until all lesions, active lesions, have been resolved. And for such mothers, maternal medication is advised by the medical professionals. Generally, these are for informative purpose like cytotoxic drugs like cyclophosphamide, methotrexate, doxorubicin may interfere with cellular metabolism of nursing infant. Hence, they are incompatible with breastfeeding. So when mother is under such medication, so breastfeeding is not advised. And again, these are not hard and fast rules. It depends again. So the medical officer or the medical professional under whose supervision the client is will be the best person to decide. And radioactive compounds like gallium 67, indium 111, iodine 131, technetium 99M, and others may lead to secretion of radioactive substance in breast milk. So while mother is undergoing the treatment of this thing, so this should be avoided for temporarily or for time being until the mother completes her medication dose. And there are certain maternal conditions during which breastfeeding can still continue. Although health problems may be of concern, breast abscess, so breastfeeding should continue on the unaffected breast. If one of the breasts has breast abscess, then feeding from the affected breast can resume when the treatment has started or completed. And hepatitis B, infant should be given immunoglobulin at delivery and hepatitis B vaccine within the first 48 hours or as soon as possible thereafter to prevent the infection to baby, and mother can continue to breastfeed her baby. And in case of mastitis, if the breastfeeding is very painful, milk must be removed by expression to prevent progression of the condition. Mastitis is a condition where the breast is swollen and the breast nipple part or the part of the breast is swollen or with abscess and has some clinical conditions. And at the time of tuberculosis also, breastfeeding can be continued. Mother and baby should be managed according to the standard guidelines. So there are few conditions in which temporary or complete avoidance of breastfeeding is required. So you can always consult the medical officer. This is only part of awareness. There are many things, and within the very least required time, maybe even for 1 week, if we take daily 2 hours also, it will be not enough to explain each and every aspect of breastfeeding. We are trying to cover whichever is important in whatever best way possible. So what we can do to promote breastfeeding at home, exclusively breastfeeds till first 6 months. Demand feeding, which is frequent and unrestricted breastfeeding day or night. Water and other fluids should not be given to the breastfeeding infants in first 6 months. Continue breastfeeds up to 2 years and beyond, in addition to the complementary feeds from 6 months of age. Freshly expressed human link can be used safely up to 8 hours at room temperature. If it is stored in coolers, it can be used for more. Again, if we are stored in cooled storage, then that milk needs to be brought to normal temperature, room temperature, before it is fed to the baby. Again, otherwise there might be certain complications. At office or workplace, we need to advocate, support, and promote breastfeeding. See that the baby, within 1 or 2 days after discharge from the hospital or birthing center, continue frequent visits until the baby is gaining weight adequately and mother appears confident. Assess the adequacy of breastfeeding at every opportunity by the infant's weight, hydration status, and the presence or absence of jaundice. Respond to the parental concerns on feeding. Prevent and early help with breastfeeding problems are very much crucial to support and continue breastfeeding. Most common infant and maternal health problems should not preclude breastfeeding, but mothers and infants will need support from knowledgeable healthcare professionals. Each prescribing decision needs to take account of the risks and the benefits of the individual, mother, and also the baby. Provide written or printed or electronic multimedia resources for patient education to the patient, to the mother, to the caregivers. And there are special circumstances or absolute contradictions for breastfeeding where no culturally acceptable, feasible, affordable, safe, and sustainable nutritional substitutes, breast milk, are available. So have a policy on breastfeeding which supports early initiation, avoids pre-lactal feeds, practicing rooming in practices, demand feed, exclusive breastfeeding, absorbs supplemental feeds, support mother to maintain milk supply during separation, supports mother in managing express breast milk, manages breast conditions, avoid teats and dummies, protects breastfeeding from commercial influence by implementing infant milk substitutes, feeding bottles, and infant foods regulation of Production, Supply and Distribution Act 1992 as amended in 2003, which prohibits all kinds of incentives to health workers from baby food companies. Ensure that all health workers do not accept any incentives from the baby food industry or their allies directly or indirectly. Ensure appropriate training of the staff aimed at acquiring counseling skills to build confidence of the mother and practical skills to help mothers. Provide post-discharge support to avoid breastfeeding failure and consequent morbidity and growth, faltering an institutional mechanism to support the mother infant during the follow-up visits should be established, and various other initiatives as required. As we have already mentioned, counseling of mother is important to promote exclusive breastfeeding. And should be done for initial 6 months of age, and then breastfeeding should be continued for at least 2 years along with complementary feeding. Harmful socio-cultural practices, non-observance of baby-friendly hospital initiatives in the health facilities, lack of support to the lactating mother by the family in particular and by the community in general, and impact of unethical commercial strategies of the infant formula manufacturers make the breastfeeding difficult. So it has been seen that counseling of mother improves exclusive breastfeeding rates and duration of breastfeeding. And also, counseling is a method to empower a person to take most appropriate decision. Is different from advising. Counseling is not advising. It has three components: counseling, listening and learning skills, confidence building, and checking understanding skills. Each of these three skills has 6 attributes, like among listening skills, non-verbal communication, which has certain essentials like keep head at level, remove barriers, make eye contact, but do not stare at them. Keep appropriate distance, show that you have time, only if required. Always avoid physical touch. Touch in culturally appropriate manner only if required. Especially be conscious if the counselor is male or female and when the client is of opposite gender. Always avoid touching, physical touch, but only if it at all is required in culturally, socially, personally acceptable manner only. Like, a gentle pat on hand or shoulder for a second, not more than, if at all required. Always try to avoid physical contact with the clients. Ask open-ended questions or open questions. Show gestures and interest. Reflect back. Show empathy and not sympathy. We should be able to understand them, being in their shoes, being in their position, being in their perspective. And avoid using judging words. Don't keep judging. Don't try to stop them. This will stop the communication. This will interfere the communication process or the counseling process. We'll resume in a minute. And building confidence building skills. Accept mother as she is, what she thinks and what she feels. Praise what she is doing and what she thinks is right. Initially, whether it is wrong also or right, it doesn't matter. But whatever she thinks, she feels, accept it and praise whatever it is. And slowly start. If it is wrong, something should be prevented. We can first accept her perspective or praise what she is doing, and then we can give our perspective or the perspective which is right, so that she can take a decision whether to continue or move on to other perspectives. Sometimes it happens that that is the only way for them. They do not have any other way, or they think that is the only appropriate way to carry it forward. That's why they may continue with the present existing perspective or whatever they are doing. So always it's better, and give a little practical help wherever required, and give relevant information, and use simple languages, avoid all sorts of jargon, and give some suggestions, not commands. You should not order, you should not give command, but you can give some suggestions which can help them to take decisions or informed consent. Checking understanding skills. Like all these are part of it again. And generally, these healthcare providers like doctors, nurses are not good counselors, are not efficient counselors. They are very good medical professionals or paramedical professionals because they are trained in it, but they are not trained in counseling. So that is a problem. And they do not have the time also. The first thing is lack of training, adequate training. And the second thing is lack of adequate time. So that makes them not very efficient counselors. In spite of good intentions, many of them are not able to help mother to overcome breastfeeding difficulties. They have a very good, always they accept exceptional cases. Most of them always have good intentions. In fact, every human being has a good intention, but basically the premise is having a good intention, but again, various factors influence that. Including his or her thinking, or environment, her needs, her demands, wants, and various other factors that influence to be a person good or bad, always, sometimes, or in particular situation. Now, there are certain management procedures also. Now, how to treat flat or inverted ripples postnatally and help to attach the breast? It is not certain whether it is helpful antenatally, but you can see some of the women have flat nipples. That is, nipples are not protruded outside of the breast. They are just as same. There is no nipple, in fact, seen. And nipple is also part of breast at the same surface level. Some women especially has such conditions where the nipple does not protrude outside. That makes the baby difficult to latch to the breast. In such conditions, what can be done? And sometimes you see some women, they have inverted nipples. That means instead of nipple coming out of breast, you can see nipples going inside. You can see a hole in the breast where you can see the nipple. Instead of coming outside, it goes inside. Or you can see, a hole-like structure. So in that case also, baby cannot latch to the breast. Baby should latch to the breast, and by sucking the nipple and breast, baby is able to draw milk from the breast of the mother. But we have seen many conditions where it is quite common, nothing to be worried about that. Because some women have a breast. I mean, every woman has breast with nipples. Even men also have, for that matter. So nipples are common. But sometimes we have extended protruded nipples. Sometimes we have inverted nipples. Sometimes we have flat nipples. That is at the surface level. There will be no extension. There will be no extra mass. It will be at the same surface as it is breast. So in that cases, it is difficult for the baby to latch to the breast. So in that cases, what we can do, there are, again, these all are for creating awareness, but you should consult your doctor, pediatrician, gynecologist, or physician who can help you. So show the syringe to the mother that you have prepared and explain how to cut off the adapter end of the barrel. So what you can do, you can take a syringe. This is only in case of flattened nipple or inverted nipples. You can take a syringe and cut the end of the adapter at the end of the barrel. You see, a needle is attached to the syringe, right? We need to cut off that at the end of the barrel, not at the needle head, but the end of the barrel. Once we cut, let the plunger into the cut end at the barrel, that is reverse of its usual position, and take a model breast and put the smooth end of the barrel over the nipple and pull out the plunger to create suction on the nipple, and explain that with a real breast, there is an airtight seal and the nipple is drawn into the syringe, and explain the mother must use the syringe herself, and explain that you should teach her to put the smooth end of the syringe over the nipple as you demonstrated. Initially, it is required so that they are doing it correctly and they are putting the syringe at the correct place. Otherwise, what happens, instead of nipple, if she puts at some other place, again, that can create another problem. So make sure that mother identifies the nipple location and exactly the syringe which has the seal is exactly in the position where we require the nipple to be protruded. So put the smooth end of the syringe over the nipple as demonstrated. Gently pull the plunger to maintain steady but gentle pressure. Don't just forcefully pull the plunger, because that will damage the skin or the tissue. and it will create pain, lot of pain also. So slowly, gradually, with gently, you pull the plunger out steadily so that the skin, due to pressure of vacuum, it slowly, the pressure is applied on the skin to protrude from the surface. So this has to be done for 30 seconds to 1 minute. 30 seconds to 1 minute, several times a day, several times. So push the plunger back to decrease the suction if she feels pain. Sometimes, the skin is very tight because it is, and breasts are very sensitive. And sometimes mother can feel once you are pulling the plunger out of the syringe because of the vacuum, because it is pulling the skin. So sometimes the mother can feel the pain. So in that case, you can just push the plunger instead of pulling the plunger towards outside. You can push it slowly, and slowly you can remove that. This prevents damaging the skin of the nipple or areola. And push back the plunger to reduce suction when she removes the syringe from her breast. You should never take out the syringe when there is a pressure inside. Push the plunger back slowly. Even pulling out, pushing in has to be done slowly, gradually, to reduce or to prevent damage to skin and also pain to the nipple as well as areola or to the breast at large. To reduce suction, push the plunger back when she removes the syringe from the breast. So when you do this, slowly, gradually, 30 seconds to 1 minute, many times a day, slowly, the nipples, flat nipples or inverted nipples, try to protrude from your skin surface, the body surface. That will help the baby to latch to the breast and suckle the nipple. This is for, there are different other methods also. This is quite popular and common, easy method. So use the syringe to make her nipple stand out just before she puts her baby to the breast. Now, there might be certain problems while breastfeeding. Let's look at those problems and possible management for them while breastfeeding. So breast discomfort and pain. The mother can experience breast discomfort and pain. So this occurs, or this may occur due to on days 2 to 7 after birth when the milk comes in. And if milk is not removed, milk production will diminish. That's why this breastfeeding continuously is very important. Because if you don't breastfeed, gradually milk production will stop. The quantity becomes lesser and lesser, and finally you will be not able to produce milk. So the longer, the more stimulation that you give to your breast, to the mother, the more the milk production and the better the breastfeeding. But what happens due to various reasons, if the milk is not removed, the milk is not properly expressed, so the production, because production is there and there is no consumption, automatically it will not stimulate the hormones or the chemicals within the body to produce more milk. So it will deter the production of breast milk. So how do we tackle this situation, handle this problem, is through frequent, unrestricted breastfeed. So whenever baby needs, you breastfeed baby. Simple. It will help to empty the breast and stimulate the breast, and also promote increase of breast milk production. And breast massage, you can do breast massage with your hand, and there are certain techniques and procedures on how to do that. If time permits, we'll cover today, or if not, some other day. Or you can also do with cold compress may help, but observed effects could be placebo effect. Some people use soft cloth or leaves also sometimes to give massage, like cabbage leaves or some other thing, but they might have placebo effect mostly, because they feel, they have belief that that is improving, so that stimulates more that emotional feeling or the belief that it has added, now I can produce more milk. So even at times that emotions, feelings also have a greater impact on our endocrine glands and in excretion of these hormones and other things. No? So that can also act. That's why many of these remedies also, they play. Even doctors also say, they do their best. I mean, we do our best. But at the end of the day, it is the patient's belief and the confidence that matters. Oh, whatever doctor does treatment, he always try to give best treatment. But if the patient is not strong, not confident, the success rates are again vary. So the more the patient has confidence, more compliance to the treatment and more adherence to the treatment and medication and more faith on the doctor and treatment, the better the outcomes, the sooner the outcome. So there might be other problems like sore nipples with the characteristics trauma secondary to incorrect positioning, and mothers or babies are both may have evidence of Candida albicans infection, that is thrush. These might be possible characteristics for sore nipples and due to various other reasons. So, how do we manage this problem? Correct positioning and attachment may prevent pain. Consider treating thrush infection. Topical nipple treatments, nipple shells or nipple sheets have been shown to be effective. Evidence for safety of nipple cream is very weak. Don't use these cosmetic and nipple creams and all, which are available. They are detrimental. They do not show much, and also safety concerns are also there. Instead of that, see, the main problem with the sore nipples is due to latching problem. Positioning and latching. Latching is the attachment of baby to the breast. And position also. Now, if the baby is not positioned, what happens? Correctly, then sore nipples form. And of course, there are various other reasons also. So due to paucity of time, we are not covering what could cause, but to manage this or to prevent this, correct positioning of the baby and correct attachment to the latching of the baby's mouth to the nipples or the breast is, if it is placed, positioned, attached, latched correctly, it prevents pain. And if at all there is any pain, any infection, that has to be treated with medications. And for time being, but you need to still express your milk. So for time being, or even after that, for required time, you can use nipple shells or nipple shields. They are effective. There is some silicone nipple shields. Of course, it comes with various materials also, which are safe, which are rewashable, reusable. You can keep them on the nipple like we have artificial, nipples, like for feeding bottles. In a similar way, there is like a nipple guard or nipple shield or a nipple shell that can be placed over the nipple, through which baby can suck the, there is a hole from that where the baby, when stimulates or sucks the breast, the milk is expressed through that and baby can drink. And in case of mastitis, it is caused by a blocked milk duct and poor milk drainage, that is supply. Inside there are supply lines within the breast. Possible, I will try to show the anatomy of the breast. Just give me a second. I will try. So here, now we can see the blood vessels, lymphic nodes, pectoral muscle, areola, nipple, and we can see the ducts right? So these are caused, this condition, mastitis is caused. This is also common for every milching human being, including animal also. Even in cows, buffaloes also, in goats, those all, including animals or mammals who are having breasts, is common. This is common condition for all human beings and animals who have breasts. This mastitis is a condition caused by a blocked milk duct and poor milk drainage, and signs and symptoms range from local inflammation and minimal systematic symptom to abscess formation. So when there is a condition like this, you continue breastfeeding or expressing milk, and analgesia compatible with breastfeeding, increase fluid intake, and gently massage if symptoms continue for more than a few hours of self-management, and seek professional advice to decide whether a beta lactamase resistant antibiotic is indicated to open or remove those blocks or to treat the mastitis. As I always mentioned, you need to consult qualified medical professional. This is only for awareness and information. And inverted or flat nipples. In case of inverted or flat nipples, in such case, what we can do, we have already mentioned. I'll try to show that also. Yeah. So this is a condition. These are different nipple variations. As you can see, inverted, where nipple is inside the flat surface of the breast. The first image, you can clearly see that there is no nipple which is coming out of the breast, but there is an inverted nipple and there is a flat nipple. In the second image, you can see absolutely there is no nipple coming out of breast, and it is neither inside going inside, it is flat. These are all quite common, no need to worry, because especially we see when we talk about these things, especially in, as part of sexual hygiene or other parts or other programs awareness, people are more worried, especially children and teenagers. These are very little bit sensitive for them because they are already under peer pressure, and these all have immense impact on them. So the flat one you can see, in case of inverted and as well as a flat nipple breast, one method is that syringe method. No, you can use the syringe and cut the end of that nipple, the needle part of the syringe, so that, and you can fix a seal over that so that you can put a vacuum pressure on the nipple here, this part. This part of nipple or areola here, this part, you can fix the syringe and you can pull the plunger out so that this nipple slowly, gradually, when you do each number of times, slowly nipple will come outside. Like here you can see nipple is outside, so that baby can latch and suck this nipple and as well as this part of, so that it will stimulate the flow of milk. Sometimes we can see this is a condition where, you have hair also on the breast. But we can see in some women, initially, this is without hair, the protruded nipple. Here we can see nipple, same like nipple protruding outside, but without hair. But gradually, like this, it will go inside or it will become flat. Slowly it will become flat and then become inverted. So that is also seen. So no need to worry about all these things when we have such condition. So what is that we need to do, or how do we manage? This is for awareness only. So in such conditions, what we can do, we require skilled help with positioning and attachment, additional care and support, not a contradiction to the breastfeeding. As we have mentioned, this syringe method is a simple method. You can buy syringe of adequate size and you can use it. The mother can easily do it by herself and you can see the results very soon. And if you have difficulty getting the baby to suck, maybe the effect of maternal drugs, anxiety, or also stress. So to manage this, assessment of effective breastfeeding, encourage kangaroo care, that is, encourage mother-baby skin-to-skin contact. Let the baby cuddle, always be with the mother on the mother's chest or breast. Or due to LA anxiety, stress or pain, or there might be some challenges in expressing milk, the baby might face certain difficulty to suck. And baby not gaining weight, so weight loss less than 10% of the baby's weight. Then we need to assess the effective breastfeeding, check urine output, stool frequency, and character observation for lethargy. Sometimes babies can be very lazy, like we are also very lazy, right? At times, or most of the times, half of the day we are lazy only, half of the day we are very active or proactive or hyperactive. So babies also can be lethargic or lazy. Observe and try to make them active through various activities like breastfeeding or talking to the baby or, but adequate sleep is also required. More sleep is required as the baby is younger. And neonatal jaundice, prolonged conjugated jaundice, which lasts beyond 14 days. So breastfeed, you have to continue breastfeeding frequently, investigate jaundice persisting beyond 14 days, and appropriate management. Multiple births, and this problem, ongoing struggles with the sheer intensity of the process of breastfeeding, intense maternal support, advice and counseling, frequent feeding, feeding consecutively or simultaneously, alternative breasts when feeding twins, use cradle or football or combination position method. Even partial breastfeeding may be beneficial. So when we have more than babies delivered, when we have multiple births, it is twins or triplets or quadruplets, when we have more babies at the same time. Now what you can do, you can keep shifting the breast, or you can alternate the babies so that both the babies get adequate nutrition. And also it takes, once the breast is empty, it takes some time again to produce milk. It will not be longer. It's a continuous process that goes on. And also not 24/7 the baby can latch to the breast nipple. That is also not good. In fact, that can, make nipple sore and various other infections, because sometimes nipple also have to be dry. So that is the reason, one of the reason why, sore nipples are also formed. That is not the only factor. That is also one of the factors. And preterm babies, as we have already mentioned, those who are born before gestational period of 35 weeks or underweight babies, breastfeeding may be delayed if required or if suggested. Otherwise, you may continue. Expressing milk, mother-infant skin-to-skin contact, that is kangaroo care, as early as possible, feasible. And fortified human milk, because the baby has to gain weight, right? That is also our priority. So that's why, additionally, along with breast milk, fortified milk, human milk, that too. Not again, when we say fortified milk, it doesn't mean formula milk or other. The same breast milk can be fortified, or even if the milk is not adequate, we have these human breast milk banks, or someone else, if someone else in your family or community is breastfeeding, or nursing mother or lactating mother can also support donating some breast milk or feeding the baby. In case of Down syndrome, hypotonia, abnormal anatomic structure of the oral cavity, and significant congenital heart disease may affect breastfeeding. In that case, support and continue feeding usually improves the infant's muscle tone, improves, muscle tone also improves. Prevalence of breastfeeding among patients who have Down syndrome is similar to that of general population. So no need to worry about that. Continue to breastfeed and close monitoring for the growth. When the baby has cleft lip or palate, there might be problems like including inability to generate negative sucking pressure in the oral cavity, excessive air intake or nasal regurgitation, and fatigue leading to postnatal weight loss. So here, when the baby is having cleft lip or palate, that is a gap in the lip or a protruded or inverted lip or a split lip, different conditions are there in that, or different variations for that matter. So assistance in position and attachment is required so that the baby is correctly latching to the breast, and breastfeeding offers several benefits over bottle feeding. Again, we have seen the kind of emotions and attachments, and there are various other benefits, the bonding. And when the mother is infected with HIV, we have seen the mothers with ART can continue to breastfeed, and also when a route, it often becomes a route for transmission of the HIV virus from mother to infant. MTC infection is possible. So for that, individual counseling, screening for acceptable, feasible, adorable, sustainable, and safe criteria, promote active counseling on exclusively breastfeeding for 6 months. If all this criteria, AFASS, which is acceptable, feasible, adorable, sustainable, and safe criteria is not met, avoid mixed feeding, early weaning, abrupt weaning, prepare for stopping breastfeeding at 6 months if AFASS criteria meets. Now, how to express milk manually? Obtain a clean cup or container to collect and store the milk. Wash hands thoroughly. Ask the mother to sit or stand comfortably and hold the container underneath her breast so that the expressed milk can be collected in the container. Support the breast with 4 fingers. Place the thumb above the areola. Squeeze the areola between the thumb and fingers, pressing backwards against the chest. So express each breast for at least 4 to 5 minutes, alternating breasts until the flow of the milk stops. If the milk does not flow well, ensure that mother is in correct technique. Mother is using the correct technique. Have the mother warm compress to her breast. Have someone massage mother's back and neck. Now, finally, after collecting the milk can be stored at room temperature for 4 to 6 hours. Safely, it can be consumed by the baby. And if the fresh milk that is collected is stored in refrigerator under 35 to 40 degrees Fahrenheit, it can be used up to 5 days or 5 to 8 days, depending on the condition of the milk. If it is already taken from the refrigerator and used, again thawed in the refrigerator, if it is again, it is not fresh milk, but a frozen milk, again taken back for using, and again we are keeping back the leftover milk, unused milk back in refrigerator, then it should be used within 24 hours. Because once you take out, again it interacts with the environment. And in freezer section of refrigerator with common door, you can use it up to, if it is stored at 5 degrees Fahrenheit, you can use up to 2 weeks. Store and use up to 2 weeks. Again, if you take out and keep it again again the life will become less. And the freezer section of refrigerator with separate door. If you have, 2-door, 3-door, multi-door refrigerator, and there is a freezer, which you can set the temperature at 0 or minus degrees temperature, then you can use up to 3 to 6 months. But if you are planning to use a small quantity, instead of taking milk and keeping it back in a big container, you can always store in small containers, multiple small containers, where you can use. You can take out one container, small container, use it, and you can clean it again, get the milk, and you can put back to, instead of putting everything in a big one and again taking daily out and it, that reduces the shelf life and it also increases the contamination. So instead of that, you can use adequate quantity containers, and whenever the milk is expressed and additional milk is there, you can store it and use at the earliest. So you can use FIFO method, first in, first out. So the oldest milk you can use first, and the newest milk, because it has more shelf life. And standalone deep freezers are there, where you can use it up. When the milk is stored in deep freezers, which are dedicated freezers, generally you don't take the container out of the freezer for almost 3 months, 6 months, 12 months. In that case, once the container is kept in the deep freezer, you can use up to 6 to 12 months, depending on the condition of the milk. So you can store the expressed milk so that whenever a baby requires, you can feed the baby. So I think we can stop it here due to paucity of time. And we will see tomorrow different aspects. So thank you everyone for joining. And strangely, I don't know why we see comparatively to other programs, whenever we do this breastfeeding, we have very less, comparatively, less people joining. I think this is very important topic, but unfortunately most neglected one, and being neglected and being discontinued, which is also cause for a lot of diseases, illness, and lack of immunity and other things. So it's very important that we all attend, or if you can present, in fact, if anyone is interested to present, you can also make presentations, come forward. Or if you know someone, or even if you are a mother who have children or who have experience, you can also come join and share your experiences or any difficulties you have faced or any suggestions you have received. That will help us to create more awareness. Anyway, at an individual, whatever efforts we can put, we should be putting it, irrespective of outcomes. We should always try to put our best efforts. Outcome is not always in our hands, but whatever efforts we can put is always in our hands. So we should do always what we can do, irrespective of what the outcome might be. Sometimes it might be great, it might be less, or sometimes it may be very slow, gradual. But we should not be bothered about outcome. See, there are some trees which will not give fruits for some time. Doesn't mean that it is not beneficial. So it will take some time, its own due course of time. But definitely there will be an impact of that. Maybe sometimes our generation, we may not enjoy the benefits, but our children, our future generations will be able to enjoy or able to benefit. That is what sustainable development is, in fact. But nowadays, we are becoming more selfish, more mean. We need immediate benefits. That is where we are leading to destructive development, where we are destroying ourselves, not thinking about our future generations. What if our grandparents, ancestors thought similarly in our way? We couldn't have even born on planet, right? The earth could not have sustained for so many billions and millions of years. Even though they had more opportunities like us to exploit nature, they never exploited nature because they were concerned about other human beings, other species on the planet. That is why the planet was able to sustain, and we were able to address the requirements, needs, rights of other species on the planet. And breastfeeding is natural, sustainable, organic, pure, clean, green initiative. So let's all promote. And it is our primary responsibility. No mother wants her child to be less immune. And every mother or every parent or every family wants their child to be the best in all the ways to reach his or her highest potential. So it is very much required that mother continue to breastfeed, either directly or indirectly, through direct breastfeeding or through expressing milk and storing and giving it to baby from time to time. It is very important that we continue this practice. So thank you everyone for joining us. See you all tomorrow. Take care. Good night. Do share with your friends and ask them to also join. So take care. Good night.